Doctor, please help. That was the shout I had, occurring from the ground floor of my workplace. On rushing out, I met a woman being rushed in her own pool of blood with no sign of life. The story had it that she had delivered her baby earlier that day but was noticed to have been bleeding. This man was taken by a preventable death. In today's world, dying while pregnant and during childbirth is not new. So, maternal mortality is a death that occurs during pregnancy, childbirth, and 42 days after pregnancy has ended from a pregnancy-related cause. Since 1838, maternal mortality has been a scourge. So I call this story maternal mortality the scourge of the society. Reducing this mortality is the first agenda of the Sustainable Development Goal 3, and the target is to have a ratio less than 70 per 100,000 live births, and no country should have a maternal mortality ratio greater than 140 per 100,000 live births by 2030. In 2017, the ratio was around 211, with about 810 women dying every day, amounting to 295,000 women dying from pregnancy-related causes that year, with sub-Saharan Africa contributing to third and Nigeria 20%. The major causes included severe bleeding, unsafe abortion, infections, complications from delivery, and hypertension. Targeting a reduction of maternal deaths have had setbacks. One of the problems is the inequality among and within nations. Most deaths occur in low-income countries, and about 86% is within sub-Saharan Africa and South Asia. In high-income countries, the ratio was 11, while low-income countries had 462 per 100,000 live births in 2017 alone. In Nigeria, the risk of dying while pregnant is 200 times more compared to Sweden. Even in the developed countries like the US and UK, there is disparity in maternal deaths as most deaths occur among blacks. Another contributing factor is the inability to access healthcare due to the health facilities may be far or do not have qualified person in them. This is the case in rural Nigeria where fewer health facilities are present and the women preferring to visit traditional birth attendants. While birth attended to by skilled health workers in Nigeria was 45%, countries like France had almost 100% coverage. Another setback is teenage pregnancy. In developing countries, this is encouraged by tradition and religion. Nearly 10% of adolescents get pregnant yearly, and 21 million of them is in developing world. Some parts of Nigeria see early marriage as a blessing. Adolescent pregnancy is further complicated by peer pressure, poverty, and low educational program. These adolescents have the risk of maternal mortality as both their body and mind are not prepared for pregnancy. In addition, cultural belief system and poverty has been known to cut across so much in the world today, and maternal mortality is not left out. In some culture, giving birth at home is encouraged. Over the years, several progresses have been recorded. Between 2000 and 2017, the global ratio reduced by 38.4%, with South Asia having the highest reduction and sub-Saharan Africa the lowest. Nigeria, just like areas with the highest ratios, witnessed less than 5% reduction. Also, the global rates of maternal death in teens reduced from 0.01 to 0.005. This reduction has been attributed to better understanding of the causes and use of modern practices, though some countries like the US had an increase in the same period. The progress in maternal mortality will help in improving outcome of other sectors like education, economy, and child welfare. Such improvement was noticed in developed countries with low mortality ratio. Several initiatives have been introduced to help improve maternal mortality. One of the initiatives is the Ending Preventable Maternal Mortality, introduced in 2015, having 5 coverage targets that cut across the pregnant women health facilities and government policies. This program is not doing well in developing countries. Less fund is allocated to the health industry. In 2018, primary healthcare was addressed as the most cost-effective and inclusive means of delivering healthcare, and WHO further advised for universal health coverage through primary healthcare system. Nigeria has made little progress with 34,000 primary healthcare centers servicing over 200 million people. Some states in Nigeria adopt the free maternal and child care policy. This has helped reduce maternal mortality. However, it has put so much stress on the health system as more women are getting pregnant, knowing that the government will take care of their pregnancy. Maternal mortality has had its own problems associated with the pandemic. COVID-19 pandemic further intensified the inequalities within and among countries. The poorest countries were more vulnerable as a result of shortage of health workers, reduced access to healthcare, and reduced financial input. During the pandemic, 35% of countries reported disruption in maternal health services, and there was additional 11,000 maternal deaths in South Asia alone. To recap, maternal mortality is the death of a woman during pregnancy, childbirth, and 42 days after childbirth from a pregnancy-related cause. Such causes can be from blood loss, complications of delivery, hypertension, or infection. Sustainable Development Goal 3.1 targets to reduce maternal mortality ratio to less than 70 per 100,000 live births, and no country should have a ratio greater than 140 per 100,000 live births by 2030. Achieving this goal has had difficulty due to the inequality among and within countries, cultural beliefs, teenage pregnancy, poverty, and inability to access quality health care. Although progress has been made over the years, low-income countries like Nigeria still have the highest ratio and more effort is needed. I have seen women die while pregnant from preventable deaths. Making this story was never easy as there were many conflicting data and information. In summary, I urge all who have taken time to go through my story to give their best to curb maternal mortality because no one can tell who will be affected next.